thought I left it here sitting, and I don't have the energy for anything today. I have a bad sense of that. Bad. Good morning, ladies and gentlemen. I am happy to be back here this morning again. With me this morning on Zoom is the Honorable Jeffrey Bostic, who I can't wait till you get back out there with us, but I believe that it's another day or so. And with us here present is, of course, the Chief Medical Officer, Dr. George, Dr. Corey Ford, Dr. Clyde Cave, and Mr. Ronald Chapman. I'm not sure if the Czar is joining us, but I'd like first and foremost to welcome all of you. Today's meeting, press briefing, was really what was promised by the Minister of Health on the weekend when we indicated that we knew that there may be some concerns or questions that Barbadians would have. And as we have done with everything else, we have presented ourselves here to be able to take your questions or to listen to your comments and to be able to walk us through, because the truth is, on the last occasion that I spoke to you and the time before that, with respect to COVID, I indicated, will there be more COVID cases? And I told you yes. And we will invariably have spikes at different times, but the important thing is what we do to contain them, to isolate the persons who may be positive, and to do the relevant contact tracing to minimize the extent to which this can move through our country. We knew that once we opened back up our borders that this would happen. By the same token, I'm satisfied that the measures being taken at our ports of entry protect the interests of all Barbadians and all who are on island because of the rigorousness of the testing. We continue to use the gold standard PCR tests. We continue, where necessary, to double test to ensure where there is doubt that we literally test again to ensure that there is clarity as to the status of that person. I am not a scientist, but I've heard enough from those who test and from those who are around to know that in many instances there are some good things that we can still rest upon. Luckily, we've not had anyone in ICU for 6 weeks now. At Harrison's Point, with respect to the COVID. Similarly, we have had a situation where all who have tested positive are not sick and therefore not suffering. To that extent, therefore, I'm sure that the doctors here can answer the questions that many of you may have in your heads. And we will continue literally to put the country in the best possible position to deal with it. If you recall, on the 28th of March, when we were in the thick of things, as I indicated to you, luckily we had the foresight to develop Harrison's Point, which gives us the capacity of the 78 ICU beds to be specific, 38 primary and secondary, 40 secondary ICU beds, 120 for those who are being isolated but who do not need ICU treatment, which is the condition of all those at Harrison's Point, I'm told now. Similarly, we have the quarantine facilities at Paragon, at St. Lucie, the district hospital, and the Elaine Canterbury Center, and of course, we have the designated hotels and villas, which Mr. Chapman and his team have been so kind as to ensure meet the protocols that are necessary for us to be able to continue to manage this situation in our country. I want to remind, however, the country the need for utter vigilance. And the truth is that we knew we were going to take a calculated risk around crop over. We had no crop over, but we also knew that with people having been locked up for 3-4 months, we were going to be a little easier during the period of time that would not see an abundance of persons coming in from outside as yet. And we've done that. But now is the time for me to remind every Barbadian, be vigilant and to do the basic things that we know that we need to do. We have the mask, we need to do the hand washing, we need to do the sanitizing when you're not there, the social distance. And I'm not going to fool you, the mask sometimes is difficult, so I make sure that I don't have anybody around me when I'm talking so that I can talk to you, because if I try to talk to you with a mask on, it would be very muffled, and today with my sinuses, it would be doubly muffled. So we have to apply our hearts to wisdom and to use common sense, which I know there's an abundance of in our country. And in spite of those things that have been being shared on social media, the truth is I think that the majority of Barbadians are still adhering to the protocols that we have given them over the course of the last 4 months. But our reality is that we also cannot stay closed, and that as we open up, we manage the risks that we take in the same way that we manage the risks that we take in crossing the road or in lighting a fire or lighting a stove or all of the other things that we do in the course of life. But today is not for me to give long speeches. Today is for me as your chair of cabinet and the head of the executive to be able to facilitate the responses to the questions and queries that you may have, given that it was highly unusual for us to have had those 2 spikes on the weekend as a result of the fact that we were literally not seeing any cases for a long period of time, and we therefore anticipate that there may be a natural concern on the part of some in the society. And as I said at the beginning, my government makes itself available for those questions that we can answer that will allow your concerns or any pieces of information that you want to have to be able to be answered appropriately by us. So with those few words, Jeffrey, you're on Zoom. Would you like to add to that, please?
Thank you, Prime Minister. Good morning, everyone. Prime Minister, I just want to support exactly what you have just said. From the beginning, we always stated the fact that this is a situation where we do not have all the resources to plug all the gaps, so we have to take some risks. The risks are not reckless in any way, but the ability of the team to manage the risk, that's what is important, and that is what we've been doing. I would also like to say that the protocols that are in place have been working very, very well, and they've been doing exactly what they've been designed to do. And I can assure Barbadians that we are on top of this situation, and we will continue to manage this wisely. Thank you.
Thank you very much, Jeffrey. At this stage, I'd like to ask Dr. George or Dr. Ford if there's anything they'd like to add before questions, or are we just doing rapid fire? You want to update? Thanks, please. Thank you.
Good morning to all. Just to give you an update, mask off. Give you an update on the situation in terms of patients which we have in isolation. As of this morning, we have 27 patients in isolation at Harrison's Point facility. Thankfully, today we discharged 2 patients home. One of those patients was actually not so well and has done well, so we're quite grateful for that. Additionally, as of minutes ago, we're going to be admitting 1 patient to the facility. Within the facility itself, in the secondary isolation, which is for patients who are quite well, but we want to observe a little bit more, we have a total of 8 patients. In our tertiary facility, we have an additional 10 males and 10 females, and we have 1 male which we placed over the last 24 hours within the primary isolation area. That's our intensive care area. Patient is not dramatically unwell, but we had some concerns. This morning, I will report to you that he's doing quite well, and actually I'm going to discharge him. That's why he was delayed coming here. I'm going to discharge him back to secondary isolation and continue to monitor him. Thank you.
Thank you very much. There's only one other issue that I'll raise up front, and I know that the head of the Dos Santos lab is not with us. I'm not sure if she's on Zoom. Sanji? All right. Well,
She's on, Prime Minister, she's on.
Yes.
Thank you.
Good morning, Prime Minister. Yes,
Hi, Sanji. Could you speak to us just a minute before we go to questions? When I asked you on the weekend about the fact that you've had to test a lot of the cases that we had twice, it was because of the inconclusive nature of the first test. Is that correct?
Yes, that is correct. The method that we use at the laboratory involves a screening test and then a confirmatory test. At any time that any of the tests are even look as if they may be positive, we do repeat on those, as well as the confirmatory gene, to ensure that it is a true positive.
And your concern would be as a result of, I just want you to explain to the public what you explained to me in terms of the range on which the persons on the test range are, so that persons will better understand how all of these people are asymptomatic and basically still testing positive. In other words, pretend like me, the majority of Barbadians are not doctors, are not scientists. Break it down for us, please.
Okay, sure. I'll try my best. So basically, what we look for from the PCR, we are looking for fluorescence. So the virus, if it's present, is tagged to a fluorescent signal. And in the machines that we use at the laboratory, it actually then detects that signal. For a person to become positive or to show up as being positive in our system, there's a cutoff or mark at which we say that the test is positive, and then it is negative. And so that range of cutoff, it means that the persons must come up before what we consider the cycle or cutoff of 38. Once anyone is past that 38, it means any slight signal is actually a false signal or a negative. So for us, any person that comes up between 0 and 38, it usually happens between 15 and 38. We would consider that person being positive for COVID-19. And so it can range. If you have persons that are doing very well or mildly ill, or even recovering, their actual cutoff may be closer in the 30s, 35, 38, which means they are in the recovery stages of the infection. For those persons in the acute stage of infection, they usually show up a lot earlier, and we've had some persons showing up as early as 15, at cycle 15 or cutoff 15, and then we consider them to be in the acute stage of infection. In that stage, you would expect that means that they have a fairly high amount of virus in their system at that time. For majority of the persons that we have tested throughout over the weekend, most of those persons were in the area of greater than 30, which means that we perhaps pick them up as they are recovering. And so they're actually more likely to be in the recovery phases of the infection for most of them.
I thank you for trying where my teachers failed. I'd like to invite members of the public, those who are here or those who might be on Zoom, and members of the media. If there are any questions or queries that you have, please. And as I said, may I remind you, I have Mr. Chapman, Dr. Cave, Dr. George, and Dr. Ford.
Good morning, Sharika Griffith from CBC. My first question relates to one of the 12 who would have tested positive over the weekend. The gentleman who came in from the UK with a negative test, but when he was preparing to leave, tested positive. I just wanted to know if any further information has been gleaned in terms of contact tracing where that's concerned.
Who's in position, Dr. George? Thank you.
So contact tracing is ongoing. Contact tracing is a very deliberate science wherein we try to map the contacts of that individual for a period of time, which is the incubation period. And that is ongoing. We haven't yielded any positive tests since that test, but it is going to continue. And I'll just let you know that persons even who come in on commercial aircraft, if they test positive, we also do contact tracing for on the commercial aircraft with respect to a protocol that we use to identify those persons most at risk on that aircraft. So I just would like to assure you that contact tracing is ongoing. We have a team of committed public health nurses working with this, and a few of our medical officers of health who work within the catchment to understand the contact tracing issues.
Just one clarity. You said that none tested positive so far. Does that mean that you've been testing people?
Yes, so that part of the whole issue of contact tracing is understanding persons' risk and bringing those persons in for testing as required.
Can you also provide us with an update as to where we are in terms of testing kits and numbers at this stage?
So Sanji, I don't know if you want to, but I just would like to assure the public that there we have on island sufficient testing kits, and all equipment and supplies that are required to mount a COVID response, whether that be from PPE. We have several stores of PPE, and we have also gotten kind donations from PAHO, kind donations from the Chinese government. So Barbados has been able to, the UAE, so Barbados has been able to replenish a lot of our supplies based on kind donations from overseas.
This question is for, sorry.
Before you not finished, Sanji, how many test kits we got? 100,000?
Yeah, we have just over 100,000 tests
you.
available.
And in terms of the PPE and others, we now have a significant supply as a result of not just PAHO, but WHO sent in last week, as you saw when I went to the airport to meet the Canadian plane that brought them for Barbados and the rest of the region. And I'd like to publicly thank the United Arab Emirates for their very kind donation, not just to Barbados, but to the Caribbean community, and to say that we are truly grateful for their continued cooperation. And it's not just in the donations, but throughout this entire crisis, we have been in regular contact at a very high level with the UAE, who has proven themselves to be very much a friend of Barbados and the Caribbean community.
Prime Minister,
Yes. I'm sorry, the
just
Jack Ma
want-
Foundation was WHO too. Thank you, Jeffrey. But go ahead.
I just wanted also to indicate that we've been assisted with donations from the government of Canada.
Yes, thank you. And of course, the Canadian government and the World Food Program have also been critical, along with SEDIMA, in being able to help us with this massive logistical exercise of ensuring that we defy a disrupted supply chain globally.
This question would probably be best for Dr. Chapman. When you close businesses, as you did over the weekend, or perhaps even the party buses, how long are they closed for, and what needs to be done for them to be reopened?
I'll ask Mr. Chapman to come to the lectern, but let it not be said that I defrocked him.
Thank you very much, Prime Minister. And it's Mr. Chapman, not Dr. Chapman. For those persons who would have been closed, let me say first that we did not do it. It was not arbitrary. Those persons would have been warned before, and not only would have they been warned, they would have been instructed exactly what we expected and what the criteria was. They were also pointed towards the GIS website where all the protocols are available. So once that had been, and at that point in time, they would have been warned and they would have been told that they could have been shut down for not following the protocols, and that shutdown was only for the night. So we didn't shut them down long term, it was only overnight. And if they continued, then on summary conviction, they could be charged up to $50,000. So they were only shut down for one night.
I just have one final question. This might probably be better for the Prime Minister. As it relates to travelers coming from the bubble, there have been some concerns that we are not requiring them to have a COVID-19 test, especially since they may be coming from a country where they're doing well, but they're, of course, interacting with other passengers at the airport and then also on the plane. What would your response be to Barbadians expressing that concern?
There is no possibility of the elimination of all risk with COVID. I've said so from the beginning, and let us remember that we're not dealing with a zero-sum game. We're dealing both with lives and livelihoods. What COVID has shown, apart from the other things that we need to take from it in a positive way, because it has reminded us of the value of work, of family, of relationships, of the environment. But what it has also shown us is that it is a very, very difficult period of time for a lot of people, and mental health and mental wellness issues have come to the fore. And we need to recognize that if we can't allow human beings to interact with others, then we're going to have another set of problems beyond economic decline, but also relating to the mental capacity of an individual to function. And as you know, and I know, if a person can't function mentally, they can't function effectively. In the same way that, in fact, physically, you can be impaired physically, but once your mind is good, you're in good shape. So we recognize that we have to be able to balance lives with livelihoods, and the region that presents the least risk, the absolute least risk for us, is actually the Eastern and Southern Caribbean. But having said that, you will notice that the protocols say very specifically that if you have been in a high-risk country or a medium-risk country within the last 21 days, then you don't get the benefit of the bubble. And I want to remind you that the Minister of Health and myself in a previous life worked for many countless and sleepless days and nights in establishing the Joint Regional Communication Center, which does the comparative analysis for all Caribbean states as to where persons are coming from, as well as the security checks. So when we tell you that these are risks that we can take, we believe so fervently. Does that mean that you may not get a COVID case from one of the islands in the bubble? It doesn't, because you can entirely get that. But what it means is that the volume of cases from the bubble are unlikely to be very high, and that we can manage them. I'll give you an example. On the weekend, one person who was positive came through Antigua, but they were really coming from New York. And the JRCC picked that up. We knew that up front. We were able to test him up front. We were able to contain him. So believe you me when I tell you that this is a case of a whole of government approach, and actually a whole of region approach, by using the regional institutions like JRCC, CARFA, all of those things. Believe you me, we have it, okay? But we cannot, I want to repeat myself, we cannot eliminate all risk. We live in a world where COVID is present and for which there is no known vaccine or known cure for COVID. But we can do, as we have been doing, far better than most. And if you look at our incident, in fact, the definition for access to the bubble is that you've had less than 0.05% cases within the last 14 days. So believe you me, we're using all that we can to protect Barbadians, but protecting Barbadians does not mean protecting only from COVID. It means protecting Barbadians from mental sickness. It means protecting Barbadians from incapacity to live, protecting Barbadians from a whole host of things that go beyond a single question framework. Thank you.
Good morning to you, Prime Minister, and good morning to your panelists.
Good morning.
2 questions. The Ghanaian nurses, if we can have an update on them and how they're doing, and also with regard to our 2 ministers who were in quarantine or are in quarantine, have they as yet been tested, and what have the results of those tests shown if they already have been?
We're not in a position to tell you their test results, but I would like to ask Jeffrey to tell you. Jeffrey?
Yes, Prime Minister. Well, I certainly had my test yesterday, and the test result is as I expected, which is negative, and that is because all of the protocols which I'm enforcing, I followed those protocols, and I felt very, very confident that everything was done properly by the entire team that was with me, and so I was not surprised by the negative result.
Happy to hear you're well. And if Dr. Ford could update us on the Ghanaian nurses and how they're doing in isolation.
I think you would want both, because the truth is that there are only 8 or 9 out of 95. So I'm sure you're also asking for the other 86 who are well, but who are in quarantine.
Yes,
so Dr. Ford first, and then Dr. Cave. And then the muted question that has not been asked is how and to what extent these persons can function in Barbados. And let me remind us that the fake news that went about this weekend is one of the unfortunate moments for me in this whole exercise. Because, you know, even before the Ghanaians landed, there was a lot of fake news and a lot of talk. And I wondered to myself, if they were coming from Eastern Europe, would we have the same commentary? I hope that Barbadians accept that we are dealing with people who have come to help us. We've had the benefit of 100 Cuban nurses We have the benefit of these nurses. There has been a hiccup for only 9 of them, but I'd ask both doctors who are far better qualified than I am to be able to speak to the fact that not just these nurses, but nurses and doctors the world over have in some instances been exposed to the virus and have returned to the front line in order to be able to save more lives. Dr. Ford?
Good morning again. Thank you for your question. Update on our colleagues, as I would call them, nursing colleagues who arrived in Barbados. There are 9 of them who are admitted to the isolation facility. 8 of them are doing quite well. The one we admitted for 24 hours for observation because of a concern from our end medically, which I will not disclose at this point, is doing quite well, and I'm discharging him back to the secondary isolation area. So they're all doing well and in good spirits, and thus far have related quite well to the staff. I would go as far as to say, Prime Minister, that one of them wanted to know if they could work at the facility with us, which was quite interesting. With regards to the others who are in quarantine facility, apart from one who got ill, who's doing quite well now, they're all fine at this point.
Good morning. The Ghanaian nurses are responding to a need of Barbados. Right now, we're balancing 2 things, our COVID response, but also the health needs of everyone else in the country. And as you will appreciate, because we've been doing so well, relatively speaking, with the COVID management, the focus really has to continue to be on those Barbadians who need our health care. It's no secret that for some time we have needed additional nurses, not just numbers of nurses, but specialist, skilled nurses. And we've had the opportunity to recruit some of those nurses from Ghana. They are not yet in service looking after any patients in Barbados because they're fulfilling the requirements as any visitor would be for quarantine and isolation and the appropriate testing. Once they are cleared, we're ready to welcome them to the hospital. We certainly have work to be done. Just one word about the hospital. As Prime Minister said, there's a lot of social media concerns and questions. The hospital is unfortunately not the same as going to a restaurant or shopping. It's a very specific institution by nature of our patients who are ill, and therefore we have to protect them. So when you hear that visits and numbers are acceptable for the country as a whole in general, sometimes we have to have even higher standards for accessing the hospital, and that's to protect our vulnerable patients. In a closed institution like ours is, an older institution, and a very densely peopled in both terms of medical, nursing, and patients in the hospital, we have to be extremely careful. And so far, our plans have been working, and we hope that they can continue in that way. Thank you.
Thank you so much, gentlemen.
Thank you. I would like to say that on this issue, and Dr. Cave put it well, we can't do without the numbers of nurses that we've tried to bring in. And while we're committed to training new nurses and expanding the numbers of trained nurses, that takes time. It doesn't happen overnight. It doesn't happen in a year. It doesn't happen in 2 years. So that in the interim, we need to take care of those patients who are in urgent need of the assistance. And I want to say to all Barbadians that our brothers and sisters have come from across the Atlantic Ocean to help us and to buttress and to reinforce our health services. And I really do hope that we will treat them as honored guests. There is no reason, even with this hiccup, for any concern, but I believe that if we continue and once they're out and we're working with them, you'll begin to see and appreciate what many of us do, that they will add tremendous value and help us to save many, many lives in this country that we might not otherwise be able to save. Our health system is not perfect, but it is still better than most across the world. Any other questions? Looks not. So, Sharon?
Prime Minister, sorry, there are 2 questions coming from social media. One, why aren't people being told that they need to travel with negative tests? So why isn't that mandatory? One. And two, textbooks are being collected. So when is the school year beginning? Those are the two questions we received.
With respect to the issue of mandatory testing, look, we have said that we strongly encourage people to test. But I also know that the test which the Barbados government uses is of a certain quality. And therefore, we have no difficulty in testing persons when they come. Part of the difficulty is people's ability to access tests within a timely frame. I spoke to Governor Cuomo about 4 weeks ago, asking for us to be able to look at establishing a testing facility in New York in order to be able to test persons before they got on the plane almost immediately. And I want to break this down, and the doctors can feel free to come after me and explain it, because I've read the comments, not just now, but for the last few days from people. Governor Cuomo made it clear that the ability for labs in the US to be able to give people test results back within 72 hours is severely compromised. And at that time, national labs were taking 6 and 7 days to give back people results. Even if we tested 24 hours before, there would be a risk for the 24 hours. And that is why our team here, and I want to commend them for it, strongly recommended that the government of Barbados for high-risk countries will test within 7 days of arrival to Barbados, because that period of risk between when you tested and when you reach here, that we recognize that the incubation period of 2 to 6 days may mean that even if you have a negative result, you can have a positive within 2 to 6 days of your exposure. That is why Minister Bostic and Minister Cummins and others are at home this week, because their exposure would have been at that point, and even though they've tested negative, the CMO is saying give it another day or two in order to complete fully the 7 days. Now, we do that recognizing that this is the best way to manage risk. In an ideal world, the airlines would be testing. But the airlines made it very clear globally, not in the Caribbean, globally, that they are not testing and taking responsibility for testing. In fact, IATA was also part of our discussions, which is the airline body for globally that exists. And therefore, we came to the conclusion that if there are deficiencies on that side of the equation before people come here, let us correct the deficiencies on our side of the equation when people land here. We don't have control over there, but we have control on this side. So I hope that that better explains to people why we cannot mandatorily require. If we did, we would effectively be back to April and May. Our economy has revenue in the first 2 months of this fiscal year declined by 31%. And you'll hear the governor of the central bank this afternoon as to the performance of the economy in the second quarter, which was also weak. Now, in spite of the fact that we've had, 2,500, 3,000 people come probably in the course of the month of July, how many cases have we had? They've been negligible. So I want us to locate, because very often, sometimes, and let us be clear, this government is at half term, so I already see the beginnings of those who believe that the silly season can start early. But I hope that when they're starting the silly season, that they remember that if they don't wrap themselves in the flag, that all they're going to do is to make it bad for everyone and not just themselves. And if you need to lift yourself up by tearing down the country, then we have a problem. With respect to those who are genuinely asking about that time frame, I hope that that response lets you know that this is not something that we ignored. We've thought about it, but we've put a mechanism in place where we can control it, and that is when they land in Barbados as opposed to before. The last point that I'll make is this, is that many countries use many different types of tests. And Sanji is still on the call, on the press conference, and she will tell you more than anyone else that all the people who come and say, oh, we have these rapid tests for you and these antibody tests, this gentleman here refuses and says that simply we've not had enough exposure in the population for antibody tests to make any difference. So anybody who's offering you a blood test that is a rapid antibody test, no. What we may need to do is to tweak our protocols, and I'll discuss it with them, where for those coming in, we can use the antibody test because of the prevalence in their populations, look at the antigen tests, and then determine thereafter whether you need to move to the PCR testing as we go forward. But let us be clear. Let us be clear that there is no path, there is no script. And therefore, countries, as you can see before your very eyes, that there's not even coordination between some states in the United States of America, far less coordination between them and us. A country like Canada, that is very low, medium risk, we've had virtually none. Very, very low. So, horses for courses and protocols for horses and courses.
Prime Minister, if I may add one thing here.
Please.
Yeah, just because I think it is important, and in response to the last question, I believe that I should say to the public that we've had persons presenting at the airport with tests, but the tests did not match the requirement or the criteria established by the government of Barbados. And then we've had to turn around and do the testing here at the airport. So even though persons, even if everyone had the test before they arrived in Barbados, we've been able to determine that a number of those tests really did not meet the standard. So we had to test them ourselves.
Good morning, Prime Minister. Anesta Henry from Barbados today. Are we satisfied that we are on the way to more job creation? And what else can be done to stimulate jobs in the non-traditional areas?
That we're working non-stop to do it. I've told you that in this period of time, the capital projects that are both public and private sector are being ramped up. By the same token, we're also ramping up the digitization of our records, and we are also expanding significantly the training under the National Training Initiative. We believe that those three things, when combined with the 12-month Barbados Welcome Stamp, which is intended to be able to create more long-term visitors, because short-stay visitors will always be a problem within the context of these testing protocols, that we believe that we can start to claw back and to get back progress and to have more Barbadians going to work going forward. But I want us to be clear, you know. A child born in 1900, and you've heard me say this, some of you already, would not have known stability until about 1950, when they reached 50 years old, because they would have gone through 4 years of World War I, 2 years of the pandemic, then into the stock market crash and Great Depression of the 20s, then into the fascist and dictatorial leadership of the 1930s that led to the World War II of 1939 to 1945. We are going through a period of global instability. Almost every country in the Western Hemisphere will see significant declines, and those in the eastern part of the world as well. The truth is that in many instances, we are seeing economic declines that we have not seen since World War II, and in some instances before that. So what is important? That we keep as many people healthy and alive with their heads above water between now and the next 6 to 12 months until there is an accessible vaccine, because there may be a vaccine, but the question is, will it be accessible to all? And the next big hurdle is who will be prioritized in the use of the vaccine. The second thing is that we also have to recognize that even without that, there were other global points of instability, and for us, the major one is climate. And what the Bajans tell you, what ain't catch you, ain't pass you. And we are in the middle of what? A hurricane season that is expected to be one of the most active for a long time, and that you would note that we reached J in July. Now, the last time that happened in 2005, I'm told by the meteorologists that we not only finished the normal alphabet, we went into the Greek alphabet. So that you can feel the heat in here. And we really do expect that we are going to have to be very, very proactive with respect to preparing ourselves for any kind of weather system. And the government, as you know, has been doing that over the course of the last few weeks trying to make sure that as many communities and people can be protected. So all of that leads to additional jobs, my dear. And in addition to the structured program that I outlined to the country earlier, plus the support systems to be able to help as many of our enterprises stay alive. But at the end of the day, we are not a first world country, but we will try our best to make sure that as many of our people as humanly possible can keep their heads above water and resume to a different type of growth when we come back after the COVID vaccine hopefully is available and accessible to all. Yes, Mr. Munsi.
Yes, this might be a question for Dr. Ford. Earlier, he would have mentioned one person admitted into isolation. Is that a new case? Just a point of clarity, please.
Yes, thanks for the question. Yes, so we had one new admission today. This is a case which came to the island last night. Yes, one new positive case. Thanks.
Any other questions or queries? If none, I'd like to thank everyone. I'd like to thank you, doctors. I'd like to thank Mr. Chapman, you and your team, and Azar, who is in here with us today. Minister Bostic, I look forward to seeing you soon again. And to say to members of the media, look, we have continued to avail ourselves to you because the most important thing in a pandemic, in my view, is communication. Frank and clear communication. When it's good, when it's bad, when it's not so good, when it's not so bad. What I want us to do, however, as a nation, is to recognize that we are all in this together, and that those who may want, for whatever reasons, to be the bearer of fake news or rumors, at the end of the day, is only the same pot of soup. And when you put things in the soup that shouldn't be in it, then everybody drinks from the same bowl. So let us remember that this is the only country that we have, and this is the only life that we have, and that we know that we didn't set out to create COVID, but as Jeffrey Bostic has reminded us from this position, there shall be no retreat, there shall be no surrender. I'm thanking you once again and reminding us that please be vigilant, be safe, and with God on our side, we shall have no hopes, no fears, nor no challenges going forward with respect to this virus. On the other matters, the governor of the central bank will speak to you this afternoon, and he will contextualize for you where we are as a country with respect to our economy. It is difficult, but I will speak to you again in the future. But I know equally that we can make it. We've actually been doing reasonably well given the circumstances, and I want to thank Barbadians for meeting us at that point in place where we can make the additional things, do the additional things that we can do to get as many Barbadians back working as possible over the course of the next few weeks and months. Thank you and God bless.